My name is Chris Bailey. I'm a physical therapist at Twin Cities Orthopedics, and I want to introduce a topic that's important to all of us, which is the anterior cruciate ligament. Today, we're going to talk about the ACL and some injury prevention techniques, and also just to get to know a little bit more about the anatomy and physiology of the anterior cruciate ligament. What I want the parents and coaches of adolescent athletes to know about is that this just isn't about injury prevention, it's really about sports performance. And that comes in two regards. One, you can't perform if you're injured with an ACL injury. And two, sports are oftentimes about accelerating and decelerating. Who can do it better? Who can beat the other player, the opponent, to the ball, to the puck, to get to the baseline the quickest, and then to stop effectively and change directions. And a lot of the prevention exercises that we do for the anterior cruciate ligament actually help with that deceleration and acceleration, the explosion and the loading and exploding that happen with sports. So that's what we're going to talk about today. Now I'm going to turn it over to some of our orthopedic surgeons from Twin Cities Orthopedics. Thanks.
My name is Jason Holm. I'm an orthopedic surgeon with Twin Cities Orthopedics. I have fellowship training in sports medicine, and I work out of the Burnsville office. Today we're talking about anterior cruciate ligament injuries. This is one of the most common injuries that we're seeing in our athletes, both young and old. Usually this is an injury that occurs in athletes who are involved in cutting and pivoting type sports. Certainly if you're an athlete who's involved in a cutting or pivoting type sport, I'm sure that you are aware and familiar of colleagues and teammates who have had these injuries. So we're going to talk a little bit about the anatomy. We're going to talk about some of the modifiable risk factors, hopefully to work on preventing some of these injuries in our athletes. Anterior cruciate ligament, I'm getting the patella or kneecap out of the way here. Anterior cruciate ligament. Ligaments are tissue that connect bone to bone, so we're a connection between the tibia and the femur. The anterior cruciate ligament runs along the front. And really the purpose of this is to be one of the primary stabilizers of the knee that allows us to cut and pivot. In particular, the ACL works to prevent anterior translation of the tibia relative to the femur. So you'll see the tibia slide forward and the ACL tensions. In addition, the ACL will commonly tear not only when that tibia slides forward, but also when a load is applied, a translation type load is applied, and also when there's a rotational component. So an athlete commonly will see, even when there's not contact, will come down, they will apply a load from the femur. They'll usually be out more in extension or with the knee out straight. They will come down, the knee often goes into what's called valgus. In other words, it kind of tips in this direction. And then there's a rotational component, and that will cause that ACL to rupture. That's when you hear that big pop that's often associated with ACL injuries, and you'll get a large swelling in the knee and obviously pain. Greater than 100,000 injuries to the ACL happening each year in our athletes. Obviously this is a condition that is of significant detriment to our athletes, and we certainly want to do everything that we can to try to prevent this injury. We also know that injury to the ACL places the knee at risk for further injury, not only re-tear, but also the risk for developing arthritis long-term down the road. And so that's why it's so critical, if at all possible, that we work toward preventing these ACL injuries. There are a variety of ways that we use to examine the anterior cruciate ligament. First we check range of motion, we check for swelling, we do an entire exam of the knee. What we're looking for specifically in the setting of an anterior cruciate ligament tear is increased translation of the tibia relative to the femur. So we do this, and we can see in this case this is an intact ACL, and so there's a nice firm endpoint where it stops, so that ACL is holding us in place. In addition, we can apply a rotational load, and we can see that in her case we get a nice smooth applied load, and we're not shifting what's called a pivot shift, where the knee will shift if the ACL is torn.
Hello, I'm Dr. Ed Schwabsky. I'm a native of the Twin Cities and did my orthopedic training at Harvard University. I'm board certified and I'm a member of the staff at Twin Cities Orthopedics. I'm here to talk to you about risk factors for anterior cruciate ligament injury. Some of them are things we can control, and some of them are things we can't control. For instance, some of them are anatomic. One factor is called the Q angle. The Q angle is the angle at which your quadriceps or thigh muscle attaches to your kneecap and then attaches to your shin bone. That's not something you can control. That's determined by your genetics, and you've developed that way. On the other hand, there are some things that you can control. For instance, you can control your level of training. We know that higher levels of training and neuromuscular education can decrease your risk for injury. The other thing that you can't control is you can't control your innate ability or your own athletic ability, but you can improve that with training. Gender is a risk factor in itself. For instance, women are 7 or 8 more times as likely to injure their ACL playing the same sport as males are playing, and that's not something that we're going to be able to control. Year-round training is another big factor, particularly if you play a sport that is at high risk. For instance, swimmers are not likely to tear their ACL, nor are bicyclists, but soccer is a sport that has a high rate of ACL injury, and with these sports becoming progressively more and more year-round sports for higher numbers of athletes, the injury rate goes up.
Okay, so before we begin the warm-up, we're going to just talk about a few key positions first that we just want to be aware of while we're executing the warm-up. And Lauren's going to demonstrate that here for us. So the first position that we're going to talk about is hyperextension. This is a position that we want to avoid at the knee while we're executing the warm-up. So Lauren's going to turn to the side and face me. She's going to go ahead and extend her knees now and hyperextend there. So what we want to do is avoid this extension movement of going back at her knee, okay? So go ahead and jump up and land for us, and we want to avoid landing in that position with her knee extended all the way, okay? We want to avoid that position because that's going to cause some stress on her knees and possible potential for injury. So now go ahead and face the camera. Another position that we want to avoid her getting into is her knees caving in, causing a valgus stress. So she's going to squat down, and then you're going to see her knees caving in like that. We want to avoid those positions. Go ahead and come back up and do that a few times. We want to avoid that position right there at the knee because that causes a lot of stress on her ACL, and so we want to avoid any landings or movement that cause that at the knee, okay? So that's something we want to be aware of. What we do want to see is a triple flexion position. And so Lauren's going to demonstrate that for us right now. She's going to get in a triple flexion position. And so at this position, you can see her knees are over her toes there. They're not caving in, and she's got a good flexion at her hips and at her ankles. She's going to go ahead and jump up for us a couple times and show us the landing with that. So she's going to hop and land. Good position there. So you can see she's landing with her knees flexed, her hips flexed, and her ankles flexed. Go ahead and face the camera. She's going to do that again facing the camera here. You're going to see that her knees are not caving in. They're landing comfortably over her toes and in line with her feet.
Next up, I'm going to talk about a few of the activities that cause tears of the ACL. So there's basically 2 groupings of activities. There's non-contact injuries that happen without any contact, and there's contact injuries that happen when you get hit awkwardly from the side, maybe you're tackled to the ground. In this video, we're really talking about preventing the non-contact injuries. Contact injuries can be very difficult to prevent and often have more to do with the type of sport you're playing and the position that you may be playing and the exposure you have to those injuries. But with non-contact injuries, we know that a very high percentage of these can be prevented with the proper warm-up and exercises. And so a big component of this to understand is a concept called latency. With latency, it means that a muscle is activating, but it's activating too late or too slowly. And in order to prevent the problem with latency, you need to actually neurodynamically retrain the body or educate the body how to move properly. So that's what this exercise routine is really all about, is the training of the neuromuscular system. New research is pointing to the fact that we know what exercises to do, now we just have to start doing them. So we have to make it fun for the athletes, also concise enough where athletes and coaches can get it done before practice, after their weightlifting routine, before their weightlifting routine. So it's really the compliance to the exercise routine that's most important. That's what research is showing now. It's not that we don't know what to do, it's that we have to comply to what those activities are. So that's what we're going to show you next.
So the beginning of our dynamic warm-up, we'll start with knee to chest. So she's going to be reaching up, getting that knee nice and high, staying nice and tall with her posture. Her head's going to be pointed up towards the ceiling. Next one we're going to be doing is a hamstring kick. They're going to grab behind their knee, lift it straight up, and extend their foot all the way out and take a step forward. So this one we're looking to work on hamstring flexibility. For females, we're looking for the stability of the single leg balance as well with this. Next exercise we're going to do is the walking quad stretch. So they're going to bend their knee and grab at their toes behind their butts there. You're going to pull back and get a nice little stretch. To modify this to make it a little more difficult, you can have them reach up with their opposite arm straight up to the ceiling. That increases the stretch a little bit more. The next exercise they're going to do is a walking lunge, straight forward. Nice big step. Getting that knee down close to the ground, keeping that knee right over the ankle so it's not going out past the toes, making sure the knee's not wobbling in, caving in into a valgus position. Next exercise we're going to do is a walking lunge with rotation. They're going to rotate with their arms up to the same side of the leg that's moving forward. Good, so really working on that rotation of that opposite side or the same side of the leg going forward there. And really working on that anterior hip flexor stretch. Now we're going to do the exact same thing, only we're going to do a backwards lunge now with this rotation to the forward leg as well. So this is obviously challenging their balance a little bit more, so they can't see exactly where they're going. We're working backwards and getting that same stretch on that anterior hip with that rotation. For increased challenge, you can do that backwards lunge without a step in between and just take one big step after the other with no steps in between. Forward lunge with our same elbow to our same ankle. So when she lunges forward with her right, she's touching that right elbow down to her right ankle, getting that good reach. Stretch those adductors. The next exercise we do here is going to be walking lunge with the opposite elbow going to the opposite ankle. Important to keep good posture through all these exercises. Once you come back up out of it, have shoulders back, chest up, head forward. Next exercise we're going to do here is walking backwards, doing hip turnouts, lifting the knee up, opening up in rotation, big step back. Working on stretching out those adductors, getting those glutes firing. Working on single leg balance as well in this exercise, moving backwards. Next exercise we're going to do is an inchworm. We're going to be working on our hamstring flexibility here, getting our arms, upper body involved, and slowly getting those toes up towards the hands. Walking those toes up towards the hands, working on that hamstring flexibility, trying to keep those knees straight. It's also a good core exercise. Since you're getting your hands involved, you're getting into that plank position once you get to the bottom and you're working through, you're moving all the way through with your hands and your toes, and it's going to get your heart rate going a little bit more. The crab walk, so their hands and feet are going to be on the ground, they're going to be facing the ceiling. They're going to try and keep their hips up the whole time moving through this. So this is definitely a challenging exercise. A lot of challenging movements going on here with their shoulders, their hips, their feet, their hands touching the ground. It's challenging for their core. Their glutes should be engaged the whole time. Their hamstrings should be engaged. Their shoulders are going to be engaged on the ground there with their hands on the ground. Side shuffle, down and back. So we're going to be low in that triple flexion position here. shuffling down and quickly shuffling back, trying to keep those feet from touching, keeping them wide apart there. Karaoke, so we're gonna do karaoke down and back, high knee up, getting that across the body. Good, quick feet, working on quick feet, change of direction. High knees, so really working on that sprint technique, getting those knees up, chopping them high, and then we're just gonna jog it backwards. Good, butt kicks down, really just working on getting that stretch on the quads, getting those feet up, getting them moving, and then we're gonna just also jog backwards on this one as well. Next exercise we're gonna do is double leg hop, working on our form landing here. So we're getting into that triple flexion position, coming out of it. Jump, soft landing on the feet, making sure the knees are over the toes, and then they're not caving in valgus. Next exercise we're gonna do is bounding, eccentric landing. So you're trying to hold that position for a count of 3 seconds, and you wanna land in a triple flexion position with the knee bent, hips bent, ankles flexed. Do a single leg hop. So she's jumping off her right and she's landing on her right. Same positions. You want to make sure that we're landing with the triple flexion position, knee flexed, ankle flexed, hip flexed. So this is also challenging for balance. You want to make sure you stick that landing and pause and hold. We're going to do the toe hops. You guys can just be in a line straight here. And we're just like if we're jumping rope, just quick toe hops. Go ahead and get started. Good. Squat jump, so we're getting down low into a triple flexion position, and then we're squatting down and getting up out of that position quickly, jumping as high as we can. So squatting down, all the way down, and coming all the way out of it, extending through, making sure that the knees staying over the toes, it's not caving in valgus. Thrust jumps, kind of like a pogo hop, so you're trying to get as much height as you can and get off the ground as quickly as you can with this jump. Same idea, you want to make sure that you're staying in alignment with the knees over the toes, nice and quick, yep, just like that if you're on a pogo stick. And you're still getting that triple flexion, but you're coming out of it a lot quicker, you're coming off the ground very quick. These next exercises involve the use of agility ladder. So the first exercise we're gonna do is 1 foot in each square. Quick feet, getting in and out real quick, good. Now the next exercise we're gonna do is 2 feet in each square, chopping them. Normally we would go through this twice so they can get a lead in with their right and a lead in with their left. Next one we're gonna do is the 2 feet in, 1 foot out. So shuffling laterally, 2 feet in, 1 foot out of the square. Working on getting those hips moving, getting those feet in and out real quick, in and out of ladders. Next one we're gonna do here is the shuffle. So we're gonna have 1 in and 1 out. And then we would also do this coming back the opposite way to have them work on the opposite direction going to their right. And the last one we're gonna have them do is just a single leg hop down. So they're gonna go with their right legs, single leg hop down real quick, in and out of that square, under control. And then normally we would do this again with their left side as well. So the last thing we'll do is a core progression. So this is a series of core exercises. We're gonna start with a plank, just a normal plank to start with. We wanna make sure that everything's in a straight line from the shoulders to the hips, to the knee, to the ankles. And we wanna make sure that the glutes are activated and that we're getting anterior core and posterior chain activation on this as well. So they're holding this position for 30 seconds, then they're gonna go ahead and relax. And you would do this at least 2 times. And so you just wanna make sure that you're also breathing during this exercise and you're not holding your breath, okay? Then we're gonna do another plank, and this time we're gonna do a plank with a single leg up in the air. So we're just gonna plank on 1 leg. So they're gonna raise 1 leg up in the air, and they're gonna hold this. So this is just a challenging progression off of the regular plank. So they're activating those glutes for that leg in the air. Then they're gonna go ahead and switch legs. So you're gonna hold that for at least 15 seconds. And then switch legs and hold that for 15 seconds, that glute up in the air. Good, you guys can relax. So same principles apply. We want that straight line going through from their shoulders all the way down to their feet. The next exercise they're gonna do is a side plank. So they're gonna roll over onto their sides, hands on their hips, and they're gonna lift those hips up in the air. Feet are stacked on top of each other, hips are up in the air. So this is challenging to keep that, just that anterior side up. Gonna go ahead and raise that arm up to make it more challenging and reach up to the sky to make it a little bit more challenging for them. Same principle applies. You just want to do this for 15 to 30 seconds each side. You can relax. Good. Next exercise we're going to do is a partner hamstring curl. This can be a difficult exercise to execute, so you want to make sure that you are doing it properly with a partner holding your heels in place. Your arms are going to be out in front of you to catch yourself as you lower yourself to the ground, keeping a straight line from the shoulder to the hips to the knees. Try not to break at the hip. And as you lean forward, you're going to feel tension on that hamstring, fall down, and then you're going to push yourself back up into a comfortable position and lean forward again, getting that hamstring going with the tension at the glutes as well. Good, and it's important to make sure your partner, good, you can relax. It's important to make sure your partner's spotting you correctly, holding onto your feet, because your feet otherwise are gonna come up in the air. The last exercise they're gonna do, they're gonna stand up and do a single leg deadlift first before we get the bands on. Good, so we're gonna do a single leg on our right side, left leg out, they're gonna reach forward and touch the ground. This is challenging for their balance. This is also activating their hamstrings and glutes, because as they come back up, you're gonna fire that glute to get back into that extension position. So they're reaching down and then they're coming all the way back up, firing that glute to get them back up into that full extension position. You can have a little bend in the knee. You don't need to have it locked out completely. So you do this on both sides. Then we're gonna go ahead and move on to the side step with a band in place. So you're gonna put the green band around their ankles. And this is working on hip glute activation, their glute med, which is important to make sure that that knee isn't caving in a valgus position. So they're gonna go ahead and side step in place there. Good, keeping those feet wide, far apart, so they're completely under tension there. They're also, you can see that they're in that triple flexion position. Their knees are bent, their hips are bent, their ankles are bent as they're side stepping. And this is mainly focusing on the glute med. So they have better control over their knees, so their knees aren't gonna be caving in.
I'm Dr. Jay Berry with Twin Cities Orthopedics, orthopedic sports medicine surgeon. If you were to tear your ACL and wind up seeing one of our specialists, typically the discussion would center around a graft type. The ACL unfortunately does not heal by itself, and therefore surgical reconstruction primarily centers on taking a graft or another piece of tissue to replace the torn ligament. The typical options for this is what we call an autograft, which is tissue taken from your own body, or an allograft or cadaver tissue. The most common sources are the patellar tendon and the hamstring tendons. There are pros and cons of each of those, which you should discuss further with your surgeon.
Hi, I'm Tanya Vladigraf, a physical therapist at Twin Cities Orthopedics. I've definitely seen my fair share of ACL injuries, unfortunately, but I just wanted to quick talk about the rehab process after a surgery. Typically, the patient will come in 2 to 3 times a week initially, because it's very important to get back range of motion, the quad strength, and get your walking normal again. We'll gradually decrease to once a week, but you'll be coming to physical therapy for about 4 to 6 months at least, until we can get you back to some jogging, agility, plyometric exercises. The quad strength is the really big piece of the recovery, so we need to make sure that that surgical leg is strong enough before you get back out onto the field. Twin Cities Orthopedics offers a few specialty programs, and one of them specifically deals with getting athletes after their ACL injury or surgery back onto the field, trying to reduce their risk of re-injury. So we typically do a 8-week program, small group between 5 to 6 athletes that come in for 1 hour a week, working on gradually getting them back to reactionary movements, working in all 3 planes of motion, doing a baseline measurement the first week, looking at single leg hop and a balance test, and then retesting at week 8. And our goal is to get you to at least 90% of what your non-surgical leg is at, to reduce that risk of re-injury. There's more information on the tcomn.com website about all of our specialty programs, so definitely check that out.